Hi, everyone. That was a wonderful session with Julia, Michelle, Dr. Z, and Deanna. I'm sure lots of learnings, lots of good insights in there. So welcome to our next session. We are going to be joined by Abigail Kiso and Kyle Bratz, the CEO of FullScript, as they explore the future of holistic health and whole person care. You're going to learn how technology is shaping wellness, the latest innovations and strategies for practitioners to thrive in an evolving health landscape. And I will let you take it away, Abigail and Kyle.
Awesome. Welcome back, everybody. Super excited to dig into this one. I'm thrilled to have you all here for a fireside chat. We're in for a real treat as we sit down with none other than Kyle Bratz, the co-founder and CEO of FullScript. So I'm curious. Practice.
Uh-oh.
Hello?
I lost you there for a sec, Abigail.
Am I back now?
Yeah, you're back.
Okay. I was just wondering who uses FullScript in your practice. Maybe let us know in the chat. I'm curious to see how many of you are familiar with it. I do. Okay. Awesome. Chat is lighting up. So I won't go into what FullScript is right off the bat, since so many of you already know. But let me introduce you to Kyle. So Kyle has been a driving force behind revolutionizing how practitioners prescribe and manage integrative healthcare. Kyle's vision and leadership have really turned FullScript into a leading platform that empowers practitioners to provide better care for their patients. And FullScript quickly became a top leading platform in our industry. So many of you are using it. It serves over 100,000 healthcare professionals and over 6 million patients across North America. So Kyle, it's an honor to have you with us today.
Oh gosh, the honor's all mine. And honestly, it doesn't get old, like seeing the chat light up. And sometimes when I'm traveling and I have the FullScript sticker on my laptop, and I have patients and practitioners come up and say they use FullScript, it's pretty special. So it's nice to see that, and nice to see everyone today. So I'm proud to be here. Thanks.
Awesome. Yeah, I feel the same. It never gets old to me seeing screenshots of Practice Better and That Clean Life being shared on Instagram. I just love that. It never gets old. So I totally get it. And we're excited to dive into your journey and hear your insights today, and also what's next for FullScript. So I'm going to get us started right off the hop, because when I've been seeing FullScript on LinkedIn and across social media, I've noticed that you have a really strong point of view, and the point of view of Practice Better is pretty similar to FullScript. So Practice Better believes practitioners deserve a modern EHR that supports the holistic health of your clients and your business. And FullScript believes care providers, clinics, and health leaders can deliver whole person care at scale sustainably. So I'm wondering, what does whole person care mean to you?
Yeah, I mean, to kind of give you a little bit, I might go into like a little bit of the founding story, because I think it might be helpful. I think for me, I actually started as an entrepreneur building a not-for-profit. Woke up every single day just being so inspired, because I felt like I was making real impact. I was planning a cycle across Canada. I was raising money for the Canadian Cancer Society, and I was inspiring Canadians who battled cancer. We built this not-for-profit. We made all this impact. We raised $150,000 for the Canadian Cancer Society. I said, "Oh, this is what I love doing. I love building. I like creating from scratch." And I went and created a animated video company. And I had the same sort of like drive where I loved building the team. I loved like building a business, but it was like missing that impact. It was missing that purpose. And so for me, I looked at my co-founder, and his wife was a naturopathic doctor. And we said, whatever we do next has to be something we can do for the rest of our lives, like a forever mission that actually matters. And, for us, our mission is helping people get better, and in partnership with our practitioners. And so for me, like understanding what a naturopathic doctor did, and then understanding what all of these different practitioners and different modalities, how they were practicing differently. And to me, like what I saw just made sense. So, when you think about like a technology entrepreneur getting into an industry, I think actually for myself, like being an outsider from healthcare was a huge advantage, because I was able to look at healthcare and be like, to me, it makes sense to focus on whole person care, prevention, and health promoting care. And to me, that means incorporating nutrition, supplements, exercise, mindfulness, comprehensive diagnostics. I think it means that care is a journey, right? I think a lot of times when you think about more conventional care, it's episodic versus like it's an always on journey. And I think, well, third, it's I think it's best when it's done with a practitioner, right? So I think when that journey is partnered with a practitioner, like that's best. So for me, I saw this, it made common sense. But what I saw in the industry that was kind of lacking was infrastructure to support practitioners practicing this way, right? There wasn't a Practice Better when we were getting started. There wasn't, the tools. There was so much money going into the infrastructure to support the conventional system, trillions of dollars, but nothing was being built for the practitioners who are more, the pioneers, the ones who like understand where healthcare is going. So, for us, that's what whole person care is. And we have this belief that if we can create a better care experience in partnership with our doctors, we can drive better outcomes. And so that's the ultimate goal. And I think that's, where our partnership with everyone on this, conference webinar is really aligned.
Yeah, I love that. We feel the same. We believe wholeheartedly in holistic health. And we really believe in that mind, body, spirit approach as well. And I know so many practitioners here in the chat have mentioned they're on the same page. I want to kind of dig into the Fullscript innovations that are on the horizon. What are the most exciting or transformative innovations you have coming up for whole person care, or maybe some recently launched?
Yeah, I think there's a few things we've started to do. I think one is we started helping capture patient context. And so that's the idea of, a patient actually showcasing the entire plan of what they're taking. So often a patient comes into an office, they're taking 2 or 3 retail supplements that the practitioner might not know about. And, sometimes you get a patient coming in with all these bottles, and ultimately we don't have the full picture and the full story. And so we've made it really easy for patients to basically scan a barcode. It updates the supplements that they're taking that might have been prescribed by a different practitioner or that they may have found in the retail market. And we're able to basically help that patient manage their entire plan rather than just the products that they're prescribed through Fullscript. So now, and what we're seeing is actually 10% of the products that get uploaded by the patient are actually products not available on Fullscript. And often they're of less quality brands or different retail brands that aren't as popular with the practitioner market, and the practitioner can start to educate the patient. The second thing we did, which actually connects, is we started to break everything down to an ingredient profile. So now you have these products that are outside of what a practitioner has recommended. We have that context. We have the 3 products that a practitioner recommended, but now we can take a look at the 5 products that a patient is taking, and we can break it down to the ingredient profile so the practitioner can see exactly what they're recommending, also what the patient is taking, and you can see that full ingredient profile. And as you start to showcase the ingredient profile, you're able to provide insights to the practitioner, right? So we can say, hey, here's a more cost-effective protocol based on the ingredient profile. Here's products that will get better refill rates. Here's all these different insights that can just help you deliver better care faster. So I think we've created this product called Active Plan on the mobile app where patients upload their plan, we keep them adherent. We've broken everything down to the ingredient profile to give practitioners like a quick view of that and then understand all of the insights. And then what we're also really excited is we've just launched a diagnostics labs product. So it allows practitioners from any modality to order a lab test, call it a blood test from Quest or a number of specialty labs, order that for the patient. Patient can check out, they go book their draw with Quest or they do their specialty kit. The results come into Fullscript, and we're able to provide interpretation, support, and protocol recommendations that the practitioner can consider. So I would say those 3 things for us right now are pretty exciting and really set us up to help continue to provide that clinical decision support to doctors, so they can just provide care faster and more effectively to their patients.
Yeah, that's awesome. I know our community was super excited when you announced labs. How has the response been on your end to that announcement?
Yeah, it's been great. I think right now we're at about 15,000 practitioners on the wait list. And, we want to be really thoughtful. When we started Fullscript back in 2011, the things that I said we need to build great product, make sure the software and the design and the user experience was, top end, and we needed great customer support. And to me, like if you build a foundation of those two things and don't lose sight of that, you'll always create a great company. And I'm sure there's been times where we've lost a little bit of sight of that, but and I'd love hearing from doctors and where I want to continue to invest in those two areas. So with the rollout of labs, we want to be very thoughtful too. So we're very thoughtful around who's getting access to it, when they're getting access to it. Right now, I would say we're building in partnership with our doctors. So there's a really strong feedback loop. I think we have about 500 active practitioners now using it and giving us feedback and helping us continue to iterate on the product and make it better.
Awesome. Do you have any hints for those in the chat asking when labs will be available in Canada?
I do actually. I don't have an exact timeline, but being a Canadian myself and living, and knowing how important this is, I'm in partnership discussions with a couple of the key labs that we would need in Canada to be successful. So, that's one of the goals that we have going into 2025 is actually, making sure that we have better parity in Canada across the board.
Yeah. So I guess in short, you're working on it.
Working on it, yes.
Love it. Awesome. I did see a few notes in the chat, and I wanted to kind of like rewind and hop back because I saw somebody ask, what is FullScript? So I might have jumped the gun a bit thinking everybody knew. So could you just give us a quick overview of what FullScript is and who can use it?
Yeah, FullScript is, it's a platform that makes it really easy for a practitioner to write, and create whole person care protocols, specifically around the supplements that their patients should take. So we have a catalog of over 300 plus branded supplements. We have distribution centers across North America, and practitioners can use the platform to write treatment plans for their patient based on the supplement protocol that patient should have. The patient receives that protocol on their phone via the mobile app or the web app. They can buy those supplements. The products are drop shipped right to the patient's door, and then we help the patient manage adherence. So we know when the products are supposed to be taken. We know when they should have refills. We know when we get feedback that maybe they want to see a practitioner again. So we're able to really be the partner to the doctor to make sure that that patient actually follows their plan long term.
Yeah, I've been on,
and obviously now we've added labs to the product now as well.
Right. I've had an interesting experience seeing a naturopath maybe 15 years ago before FullScript and sitting in her office and looking at like walls and walls of supplements, and then seeing that same naturopath 5-10 years later and her just sending me a prescription after the appointment for the supplements on FullScript and those being at my door the next day. So it's pretty revolutionary for practitioners not to have those supplements stocked in their offices, especially nowadays where so many practitioners are virtual.
Yeah. And one of the things that we've noticed, sometimes it actually makes sense to have acute care products in the office, or sometimes, there's practitioners who's done a really good job building an inventory and they just have it down pat on the management. And we don't want to get in the way of that. We actually want to support that. A lot of what we focus on is you may dispense in your office, but then the patients aren't coming back and they're going to Amazon, they're going to all these different areas that have lower quality, they don't have the same sort of quality programs and testing that FullScript does, and you lose that connection. So for us, like even with a practitioner who dispenses out of their office, like sell the supplements to the patient, just make sure that patient sets their active plan up and let us help manage the refill. So I think there's like a place actually still in the world for practitioners that want to carry the inventory. There's better earning potential when when you're carrying the inventory in different ways, but then you want to be able to capture that refill, which a lot of practitioners, miss out on when they're not using a software platform like FullScript.
Yeah, got it. Okay, that makes sense. Real quick, what practitioners or what credentials do you need to use FullScript?
I mean, we have a very broad base of credentials, and based on credentialing, there may be some access, differences based on like what the catalog, what access you get to the catalog and everything like that. But ultimately, from call it nutritionist, dietitian, medical doctor, nurse practitioner, naturopathic doctor, chiropractor, acupuncturist, like the list goes on of modalities that we support. And then with the labs offering in our off network, we're able to support a lot of practitioners, helping their patients on more of these journeys with diagnostics as well.
Awesome. Okay. So hopefully that gives everybody a quick overview. Sorry for skipping that at the beginning. Kyle, I'm wondering how you foresee emerging technologies, especially AI or telehealth, shaping the way holistic practitioners operate.
Yeah, I think there's a lot of entrepreneurs and tech entrepreneurs who are looking at AI and saying, I think it can replace a practitioner. And I just think it's bogus. And for me, it's, when we started, our guiding principle is, put the practitioner first always. And that often means building, great product for the patient, making sure their experience is great. But to me, like AI helps give our superheroes superpowers, right? Like when we think about the practitioners we partner with, like again, to me, they're the pioneers. They're the ones who are actually practicing more boldly in the way that you should practice care, delivering real value to customers. And to me, AI just allows us to give them more tools to be successful. So for me, I think it's an important tool. It helps us do our jobs better. It helps our practitioners do their jobs more effectively and quicker, and maybe get insights that they wouldn't have gotten, right? When you start to think about the data on FullScript and all the different prescribing trends we see, we can start to use AI to help doctors make better decisions based on the outcomes we're seeing and the different things that are happening on the platform. And I think that's really valuable. But ultimately, like the empathy and that journey being better with a practitioner is our belief. And even with emerging technologies like AI, I don't see that going away.
Yeah, I agree. I have a background as a registered nurse, and empathy is one thing that I don't think AI can ever replicate. And that, one-on-one therapeutic relationship we have with our clients, AI will never, ever replace that, in my opinion. And I think we're just on the brink of what AI can do for healthcare as well. We see a lot of our practitioners using it for like marketing and writing, but I think we're going to see a lot more of it used for prevention and diagnostic measures in the future.
Totally.
Just curious, has FullScript integrated AI into the platform yet?
Yeah, I mean, a lot of to me, like if you're building a tech company, like AI is table stakes in a lot of ways. So we use AI to like help build out the ingredient profile, break the catalog down to its component parts. A lot of the insights that we're generating in real time are driven by AI and machine learning. In our labs product, the initial interpretation that we're providing around optimal ranges for the doctor to edit and the practitioner to edit is all generated by AI. So we're using AI, and the way we look at it is time savings, right? Like if we can save the practitioner time so they can practice a little bit differently, maintain relationships longer, and actually, like we kind of have this like internal metric is how can we get the time to write a treatment plan for a patient as close to 0 as possible, 0 seconds as possible, while still maintaining the quality of care is like a critical kind of North Star for us. We'll never get to that point of 0, but I think having that North Star allows us to leverage, tools and technology like AI to really help our practitioners.
I love that. 0 seconds, as close to 0 seconds
as close to 0 seconds as possible. Yeah, exactly. We got a long way to go.
That's really awesome, because I'm sure so many practitioners, and let us know in the chat if you agree, just, find themselves spending time on these like tedious tasks that could be a lot faster. So I think that's such a great North Star metric, because time, is something that so many of our practitioners would love to get back. Okay, I'm wondering about the most significant opportunities for holistic health practitioners. What you see are the most significant opportunities for health practitioners adopting new technologies and also integrating them into their practice.
Yeah, I mean, it probably goes back to that same kind of vein, which is like time savings. I think the opportunities, and a lot of what we're focused on is how do we improve the workflow, capture the patient context so that we can make these decisions quicker. So I'll give you an example. Like as we look at integrations with companies like Practice Better, we're wondering, okay, how can our partnership grow so that FullScript can understand a little bit of the context that maybe we don't have in FullScript, leverage that context to help the practitioner make better decisions quicker because we're able to process it with AI and our our ingredient-based catalog. And so a lot of what we're trying to figure out in our partnerships and our whole model is where do practitioners live and how do we just streamline that workflow so that, again, they get their time back. They're able to provide care quicker. They're able to see more patients. They're able to, maintain a larger client panel or patient panel. So that's where we, like, again, I think that's the biggest opportunity, at least where we play. And I think partnerships like ours are really big opportunities for us to go after.
Yeah, I agree. So for those of you who don't know, Practice Better and FullScript are fully integrated. So you can build protocols using FullScript supplements and easily get them off to your clients. I'm thinking about measuring the impact of your technology, Kyle. I'm wondering how FullScript measures the impact on patient outcomes and practitioner efficiency.
Yeah, so I think when we started FullScript, one of the things that we wanted to do, because we believe so strongly that this is the type of care model that every patient deserves and every client deserves, is try to create as much evidence-based support for what we're doing as possible. So a lot of what we've started to do is on the simplest, in the simplest form, is looking at the supplements that we have in our catalog and actually just testing the products and saying, okay, they say this much CoQ10 is in this supplement. Let's test and make sure. Let's make sure that the product, like what we say is in the bottle, is actually in the pills that these patients and these people are actually taking. And again, like you look at companies like Amazon, you do that same testing, and it's like 40% of what they say are in the ingredient versus, when we did the testing across the board, we saw amazing results, 100% across the board, and we'll keep releasing some of that. We started actually working with different clinics and and we engaged a PhD to actually go through and showcase that the outcomes from practitioners or patients that use FullScript and patients that didn't. And it was incredible. So, we saw way more engagement with the practice. But more importantly, we saw the lab results of these patients get better based on if they use FullScript or didn't. And what that means is the protocols that the practitioner recommended were working, right? It doesn't mean FullScript was healing, but it means that the patients were actually following the protocol and it really worked, and it changed kind of the lab results from that patient. I think over time, as I described, you have practitioners writing treatment protocols. You have patients getting lab tests. You start seeing lab outcomes, self-reported outcomes, and you see treatment plans, and that's over 100,000 different practitioners. It's going to be really powerful how we can use that data, again, to help all of our doctors get better. So you can just start to think of, okay, we see specifically for this condition, when these, ingredient profile is prescribed for that patient, we're seeing good outcomes consistently. Well, then we can start to share that back with our practitioner base so that they can leverage that information and leverage that education. So that's kind of the real kind of bigger opportunity to really help make whole person care, the standard. So I think that's a future we'd all want, is one where, the patient is on that journey, they're on that journey with the doctor, and they're focused on a lot more than just a symptom and a pharmaceutical.
Absolutely. Sherry said in the chat, we appreciate the testing and calling out supplements that are synthetic versus non-synthetic. It's helpful so we don't have to open each ingredient. So that's very much appreciated.
Thank you, Sherry. We're trying. We got a long way to go. I think as like an entrepreneur, you're never satisfied and you always feel like the product's not good enough. And so we are definitely, I think we have about 150 plus engineers, designers, product leaders, like continuing to try and make the user experience better. And that means virtually as well as even the offline experience for our patients.
Yeah. And I think the practitioners, I know for Practice Better and probably for FullScript too, they appreciate that, like the constant commitment to improvement and knowing we can always be better, constant room for growth. I've also seen some things in the chat about more homeopathic options and Canadian products. I'm wondering if folks have like a request for products they'd love to see on FullScript, if there's the best way to kind of submit those requests.
I mean, right now, if you speak to a customer support rep, if you speak to account manager or anyone that you normally, we collect all that feedback. And the more we get, the popularity does matter at the end of the day. Like if we get one product or one brand that we're getting a lot of requests for, then we're going to work hard to bring those brands in. Obviously, like when you have 300 brands, it's hard to like continue to add if it's like a Me Too product, but especially as we see like clinical innovation happening in the industry, we want to be the first And so we take that feedback seriously. That probably drives the majority of the catalog improvements we make. In Canada, there's been a number of like Health Canada related changes that have made it harder for supplement brands, unfortunately. And so there are challenges in the Canadian market around, building out the right catalog, and access to product is evolving a little bit, but we're committed obviously to improving. So I think anyone, that wants to make those suggestions, we take them seriously. We categorize them, and then we go after the products and brands we should bring on.
Awesome. And I know there's been a bit of discussion in the chat about ordering products from Amazon and there being a lot of counterfeit supplements on Amazon, and it's just not a safe option. So I'm wondering if you can speak to like how you determine what are the best products to sell on FullScript. Like, how do you go about choosing those?
Yeah, I mean, I think one, they're early on, the practitioner channel and the practitioner brands lived solely in the practitioner channel. And they cemented their kind of branding based on investing in evidence and investing in research, and having the right medical teams. And so there was just a foundation when we first started. But then, as I said, like I think the biggest driver is the practitioner voice or the clinical voice, right? Like for us, we don't want to just grab retail. Like retail brands are not exciting to us if they don't have the clinical evidence behind what they're doing, or the validation from the people that we trust, which is our practitioners. So I think that's probably the biggest driver moving forward, is seeing any kind of clinical research or evidence that's coming out, plus the voice of the doctors. That's really the biggest driver of our merchandising strategy.
Love that. I think that's a winning formula, is listening to your customers and letting them kind of show us the way. And we do that at Practice
it's the number one. Yeah, I think that's the we have mutual values, right? I think it's kind of like that founder mentality where you just want to stay close to the front lines. You want to understand what's going on all the time, and you can get kind of in the clouds and want to do all this innovation. Then you realize like, hey, there's a core customer here that deserves like to be listened to. And I've been guilty of trying to take us further than we are ready to be taken, based on, hey, we just should be fixing our customers' problems. So I love getting the random messages directly from practitioners that I used to provide customer support to back in 2012 and 13, and jump in and do the odd support call with my team. It's amazing.
Yeah. Well, I know everybody's super excited to see you here today, so that's awesome. I know we only have a couple minutes left, so I'd like to wrap it up with kind of a hard-hitting question for you. What do you envision for the future of holistic healthcare in the next, say, 5 to 10 years, especially as it relates to technology and whole person care?
Yeah, I mean, I think every industry gets disrupted by what's best for the consumer. It's just like it's just inevitable, right? I use like Netflix blockbuster storylines. I think healthcare is just slower moving, and it still hasn't been disrupted by what's best for the consumer. And I think all the practitioners watching this, all the practitioners that use Practice Better and FullScript, those are the practitioners that are going to drive that change. And we're here to enable it. And I think that change, one of the core pieces that are going to be really important are going to be labs. I think labs is really the tip of the spear for consumers to take a little bit of control of their health in partnership with a practitioner. And I think you start to think about I feel like whole person medicine or holistic medicine, as soon as you experience it, you have this like aha moment, like this just makes sense. And you want to tell your dad, and you want to tell your mom, and you want to tell your friends, and you want to share it with people. And I think a really good way for someone to start in whole person medicine is start that journey. Get your labs done, work with a doctor, and focus on prevention before you actually even need more acute care, or you have a chronic issue. So I think as we get more accessibility around diagnostics and practitioners together, I think we're going to see a change where consumers are going to drive this disruption. And I think the pioneers, we call them the superheroes of the practitioners that practice this way, are going to be the driving force behind all of that. So for me, I think we're on track. I don't know if it's 5 years, 10 years, or 2 years, but I think we're going to see some change.
Awesome. Love it. Well, Kyle, thank you so much for joining us here today, for talking to us about tech, FullScript. We're so excited about our partnership and the way Practice Better and FullScript works together. We're excited to see what's next. So thank you.
Thank you for having me. Take care, everyone.
Bye.
Hi, everyone. We've got a 15-minute break, and so we'll see you back at in 15 minutes to hear more from Ashley Wilkin and Tabitha Wills.